Welcome everyone. This is our first school year 21-22 Illinois Work-Based Learning Innovation Network IWIN Community of Practice session. And today we're going to be focused on work-based learning experiences along the continuum focused within the health sciences sector. So would love to hear first just kind of who's all here. Use the chat to write in your name, title, organization. Would also love to hear, I really love with IWIN to make sure that we're setting ourselves back in the space of high school and being a young person and who we are in that moment as we think about designing and implementing these experiences for young people. And so would love to hear one word that you would use to describe yourself in high school. And then just some logistics, we have a small group today. So very much as, throughout the presentations, have your computers and or phones muted, but there's going to be time for Q&A. And, even during the presentations, I think if there is a question you want to flag, please very much put that in the chat. And it might make sense even for the presenters to pause and address that question. This really is a space that we want you all to be accessing information, grappling with questions, and thinking about how you might implement a similar model or maybe enhance your own model to really deep dive and ask those questions. So please very much use the chat throughout, but we will also provide some space for Q&A afterwards. And I see some folks with their, Susan said musical. Wonderful. Yeah, we got to hear your word, everyone. What's your one word that you would say? I was trying to think about this, and I guess I would probably just say quiet. I feel like in high school, I just turned into this quiet, maybe kind of like angry high schooler too, kind of a, what's the word they use for high school, like angst, right? I was like, I'm just gonna sit back in the room and be quiet. This is all just wild. What is high school? Motivated, love it. Selfish, yeah, Student worker. Out of place, yeah. I think it's so helpful to be thinking about high school, right? We think about work-based learning and we think about what a wonderful opportunity this is for students to get to know themselves better, right? But they're grappling with a lot and they might not necessarily be thinking about their career as the first thing on their mind. They might be thinking about something else that day, right? So think about yourself in that high school space. Think about these experiences as you design them. Would you have liked them? I like to talk about my ghosts of students past, right? The high schoolers that I've worked with, either in the internship program or as a high school teacher. And as I'm designing something or saying something, would they be like, all right, Heather, I don't know about that one, right? Or would they be like, yeah, this is awesome. I would like that, right? So kind of keeping yourself and your experience and how you showed up in mind and the young people that you work with. Thanks, Ralph, for engaging in that. I know we have some new folks on the line, so just want to give kind of a quick recap of what IWIN is. So we're a statewide network. We host and invite stakeholders from across the spectrum of work-based learning. So we'd love to get some students in here. I know scheduling is always tricky during the day, but we have work-based learning coordinators, teachers. We have EFEs on the line. I know one of them is actually going to kind of speak to what that role is a bit, which will be helpful for some folks. But we'd love to get external partners in here as well, right? Your career center folks, your administration, all those different stakeholders are really invited to these conversations. And what we do on a monthly, kind of bi-monthly basis is we bring in innovative community models. They talk about what they do, they share their practices and resources, and it helps us then engage in conversations as we think about the experiences that we already have and want to enhance, or the experiences that we want to design and implement as a new thing. And so my favorite thing is how we build connections within this space. For folks to share. I know there's always things happening in the chat. There's private chats that are happening, connections made afterwards. And I think that's just incredible, right? We sometimes are in our silos within our communities, but as we share and hear what's going on statewide, it can really inform the work that we do. And then too, as we have these discussions where there might be needs for state policy changes or support systems and how we need to be thoughtful about that. So I'm going to paste it in one more time because as we go through the presentation here, and you can see even on this slide, there's a couple of resources. So if not familiar yet, please make sure to check out the IWIN Resource Hub. All these different presentations that we do get recorded and uploaded to that hub. So there's stuff all the way through from last October. And then there's a newsletter that we send out, every month or every other month with some information, resources, and some registration links for upcoming events. And so I just have two quick slides here, and then I'm going to turn it over to our first presenters. But where we're really going to be focusing on through this next school year is looking at the work-based learning continuum from career exploration, team-based challenge to career development experience within a specific industry sector. So again, today's focus is going to be in the health sciences. Our upcoming ones will be in education and IT. So if you would like to present on either one of those industry areas, if you have folks that you would recommend, I would love to hear about that. And again, you know, I tend to not introduce myself, but I am Heather Penzak. I'm a policy and program manager here with Education System Center, who really works at a state and a community level to influence, drive, support implementation of policy, right? And really work closely with our state agency partners and our community partners to make sure that the policy that's being created reflects the needs of communities, and that once it is created, communities can grapple with it and think about how it can best support their efforts. So a lot of my role is in the work-based learning space. Work closely with the State Board of Education, the Department of Commerce and Economic Opportunity to write the Career Development Experience Toolkit, which is on the IWIN Resource Hub. But so hosting then here, you know, as I've been connected to communities and hearing from them, bringing communities on to talk about each moment of this continuum. And so again, today we'll be focused on the health sciences sector. And these definitions are all from the Illinois Career Pathways Dictionary. So just put these up here for you. I know it's a lot of text to read right now, but do want it there for your reference. The reason we have these definitions, and as you look at them, they are pretty broad, right? But they do spell out some key factors for quality to make sure that students and young people, they're engaging directly with those employers, those industry experts, that they're working with problems that are really related to employers within that area. And then especially within the career development experience, once a student moves into that more kind of robust space, that they're getting compensation or they're getting credit, right? Because they are now really providing work back to that employer. So just putting these here for your reference, and we're going to talk through each of these as we go through the continuum today. And so our presenters, we're going to start out for career exploration with the Whiteside Area Career Center. Team-based challenges, you're going to hear from District 211. And then for career development experiences, you're going to hear from the Danville Area Community College. So with that, I will turn it to our first presenters here with Sheila and Carrie, and I will mute myself. And I'm usually pretty good at knowing when to go next, but please just prompt me if you want me to move forward.
So hi, I'm Carrie Weedoff.
Sheila Fane.
She doesn't normally sound like that. I'll kind of do the bulk of the talking today. So I guess you probably don't even know where we are, a lot of you. So we're in Northern Illinois. We're in a little town called Sterling. We are the Whiteside Area Career Center, which is a vocational school. We have juniors and seniors from 18 different schools within our area. The farthest ones drive about an hour to come here. So I teach the Allied Health Program, which consists of medical terminology and phlebotomy.
And I teach, pardon my voice, I teach the Health Occupations Program, which is the CNA program. So for my program, it's dual credit with Sauk Valley Community College, which is the local community college in our area. They get 8 credits throughout the year for Nursing 101 and Nursing 103. And they have the potential for the CNA certification at the end of the year if they meet all of their requirements, which would be all the hours, the 80 theory hours and the 40 clinical hours. And then they maintain a C or above throughout the year. And then they're able to sit for the CNA exam. They get CPR certified throughout the year. So that wasn't always a requirement, but now it is a requirement for the state of Illinois for CNA programs. With my program, it's not just me. I have a lot of other bodies or people involved. I am the theory instructor, so I teach them theory on Monday, Wednesdays, and Fridays. And then we start clinical in October, but up until clinical, we're in the lab. We have a lab connected to my classroom where we're learning all the CNA skills, starting to test on some, and getting comfortable before we go out into the actual clinical sites. So it's me, I'm the theory instructor, and I also teach lab and clinical. Carrie, on Tuesdays and Thursdays, when her students go out to their internships, which she'll talk about, she comes to my class and teaches clinicals. And then we have 4 other people. Jill Adolph is another clinical instructor that works every week, Tuesdays and Thursdays, and then the other 3 are PRN clinical instructors. We have a program coordinator as well, Susan Hamstra, who does all the behind the scenes stuff with IDPH and background checks and all of that behind the scenes stuff that has to be done. Our 3 clinical sites currently are Citadel of Sterling, which is a long-term care facility right here in Sterling. So they get to work on the nursing home wing and the memory care wing as well. We go to Exceptional Care and Training Center, also in Sterling. That is a facility for all profoundly developmentally disabled residents, most all wheelchair bound, nonverbal. So it's really good experience for our students. And then our 3rd site is CGH Medical Floor, and they do a rotation there as well. As you can see, these 3 sites allow the students to work with a large variety of patients or residents, including the elderly, developmentally disabled, and then acute care patients at the hospital. Just a few pictures of my students having some fun. COVID has really thrown a wrench into some things, as you can all imagine. And so we've had to get really creative with how we do some of our things in the lab, you know, with social distancing or having to keep masks on. But my students have really been flexible and we've gotten the job done. So here's just a few pictures of them in class doing their thing. The picture with the balloons is we used balloons one day and made faces on them to practice shaving. We then put shaving cream on and we shaved the balloons because, as you can see, there weren't a lot of males that we could practice with their actual face. Just some more pictures of the students doing their thing, taking some blood pressures and practicing in the lab.
All right, so on to allied health. My background is as a nurse, registered nurse. I did med-surg, so just a medical floor for 2 years, ER nurse for 7 years. I still work part-time or as needed in the ER. And then I started here a year ago and kind of helped develop the new phlebotomy course. So my class is dual credit for the first semester, again, through SVCC or Sauk Valley Community College. So nursing 116 is medical terminology. That's 3 credits. And then phlebotomy, they get a optional phlebotomy certification at the end of the year, but it is not a dual credit class at this time. So for medical terminology, a lot of my students don't necessarily want to go down the nursing path. I have a lot of students that are interested in being a vet or a vet tech, a lot of physical therapy students, chiropractor, dental, just a wide variety. So I tell them whether you want to work with humans, you want to work with animals, no matter what, medical terminology is going to give you that main foundation. And then again, they get CPR certified. Sheila and I are both instructors for CPR. So we do CPR for our students, and then we also offer it within the community as well. So I start the year at the very beginning. I just ask my students to put on our online kind of class page what they're interested in, what they want to see, so that when we start our internships, I know where I want to place them. So we start our internships at the end of October and they run through usually spring break, the end of March, early April. They go on Tuesdays and Thursdays and they get a total of 4 rotations. So I have students that go to various vet sites, which has been an issue. A lot of the vets weren't letting us in last year due to COVID. So I had to get creative with the animal lovers. Dental offices, we've got 3 local hospitals that they go to, Morrison Community General, which is CGH here in Sterling, and then Catherine Shaw Bethea, or KSB, which is in the neighboring town. Orthodontic offices, I've got 2 of them that work well with our students. lots of physical therapy locations. Physical therapy is a big one this year. I didn't put it on here, but chiropractic offices, I've got 6 or 7 that take our students. And then they go to community general or CGH lab for their phlebotomy clinicals. So phlebotomy just started last year, so that was kind of interesting. The kids seem to love it. And I tell them, again, whether you want to work with animals, you want to work with humans, you're going to have to draw blood. You're going to need to know veins. And just being able to work as a phlebotomist would be a great job through college, especially for people that want to work in a hospital. Phlebotomists kind of see everything. So it's very hands-on. They liked that. First semester medical terminology is just classroom work. It's not really hands-on. So for this, as you can see in the pictures, they got to be hands-on Monday, Wednesday, and Fridays when we were in the class. So you do have to be 18 and a high school graduate to work as a phlebotomist, but they can take the test up to a year before they graduate, so they can still be certified and then hold on to that until they do turn 18. So what else do we do? Again, we talked about the CPR certification. We do bring in a lot of guest speakers, healthcare related movies. I try to show a lot that relate. This week, we're talking about the brain and the nervous system. So we're going to watch the movie Concussion, which if you haven't seen it, it's a great movie. Field trips we didn't get to do last year, but we're hoping to do that again this year. We're hoping to take them to the Museum of Science and Industry. And at the end of the semester, we do resume teaching and mock interviews to kind of get them ready for the real world. So we bring in usually some nurses, people who have worked higher up and have done a lot of interviews. We'll bring them in and our kids sit with them and do a full interview. Oh, she said she has a slide on that. We'll talk about that more. So jobs, the medical field is endless. You can do so much. So CNA, phlebotomists, nurse, doctors, surgical techs, vets, vet techs, pharmacists, goes on and on. And then tuition reimbursement is a big one. I tell all my students, if you can get hired in a facility, a lot of hospitals and nursing homes and medical offices will offer tuition reimbursement. So that's huge if you can get in with a hospital or a healthcare facility right out of high school. So last year I had one of the guest speakers was the chief of fire from Dixon. They are all paramedics too, so they brought in that side of it as well. I had a paramedic and firefighter from Chicago. He was actually the father of one of my students. He's retired, so they live around this area now, but the students loved his stories. I had the lab director from CGH.
Excuse me, I had a wound nurse from CGH come and she presented while we were on the integumentary system. So I try to get speakers in that are related to the chapter that we're on that week. So I had the wound nurse that week. I had an orthopedic surgeon who's actually my dad. He came in when we were on the musculoskeletal system and talked about his job and the things that he does. And then when we were in our mental health chapter, I had an RN that I know who's a NAMI member. If you've never heard of NAMI, it's the National Alliance of Mental Illness. She's had very real life personal experience with mental illness that she was willing to share with the students, which was awesome. So second semester is when I pull in the majority of my guest speakers because that's when we are on all the body systems. So I try to get nurses or doctors that work in that specific area to come talk to our students about that.
Oh yeah, and then we did a couple guest speakers that we combined our classes. So KSB, one of the local hospitals, they did kind of a career day. They brought someone in for nursing, someone for respiratory, someone from physical therapy, someone from pharmacy, somebody from the lab. There was somebody from human resources too. They brought in a ton. And so each of them kind of did a 10-minute thing. Our class time is an hour and 45 minutes. So each of them talked for about 10 minutes and it was really great. And actually a lot of Sheila's students were hired on as CNAs at the hospital. So that was awesome.
They also touched on KSB when they came and did that. They talked to the students about the tuition reimbursement that we mentioned because they offer that. And so them coming in and just saying, we offer tuition reimbursement, here's kind of how it works, was a huge thing for our students. I had tons of students apply there after that.
And then we also had the Whiteside County coroner come, which the students really enjoyed that too. So hoping to get him back again. So our two classes grouped up with the criminal justice class and all of us sat in on that speaker.
It was very interesting. They
Very
loved
interesting.
it. So with mock interviews, we start working on that really
Pretty much as soon as our clinicals end.
Yeah, so our clinicals end in March.
Mhm.
And so we still have the whole rest of the year to do stuff. And so we start working on something called a portfolio, which will ultimately include their resume, their cover letter, any certifications that they have. That's really it.
Yeah,
The resume, their
that's the
cover
big
letter,
stuff.
their CPR certification, and any other certifications they might have. Awards. I always tell my students to throw any awards they have into their portfolio. And their portfolio is just something that they can bring to their interview that has all their stuff in it. They're ready to go. They're ready for an interview. So as soon as we're done with clinical and internship, we start working on resume prep, cover letter prep. We work on interview questions. We give them questions they might be asked and have them practice with each other on how to answer those. We talk about the application process, and we both have our students fill out an application.
Mhm.
And then we also, which is huge, we talk about appearance and professionalism within an interview. And then like Carrie mentioned, when we're ready to schedule those mock interviews, we bring in professionals from the area that they don't know. So it's a new face, somebody that they don't know. And we schedule them on certain days, certain school days, and they come dressed and ready to go with their portfolio and have an interview with that person.
So I already kind of touched on this, just the allied health is great. My class is perfect for anybody that wants to be in the medical field, but doesn't necessarily either know what they want to do, or for people that know what they want to do and they know it's not nursing, we tell them to take my class versus health occupations, which is the CNA class. If you don't want to be a nurse, you don't need to be a CNA. So again, medical terminology is great for any medical field, any career you want to go into. And then getting the phlebotomy certification is great too. So this year, I think I have a total of 64 students broken up in 3 classes. So they're popular classes. We love our students. The students really love being hands-on, getting to go out into the work field.
I have 54 students this year broken up into 3 classes. The common question that Carrie and I get is students who aren't sure which one to take. And obviously mine, you get your CNA, you get 2 nursing, college nursing courses under your belt. So I always encourage anyone interested in the nursing field to take my course for their first step. And a lot of students who are juniors who take mine and get to come back here to WACC their senior year, then take Carrie's. So if they get the opportunity to come 2 years in a row, we encourage them to take my course junior year and then Carrie's course senior year. There's our contact information if you guys want to reach out to us for absolutely anything, please do.
Or if you have any questions now, we're open.
Yeah, we can definitely spend some time with questions. And I was just gonna say, I love the variety of guest speakers that you all have. I think there's a lot of young people who are like, I want to be in the medical field. And then they start to actually understand like the different pieces that are within there and the different routes they can go. I think that's one of the most impactful parts of career exploration is that exposure to all the different things that you can be within a field. And I also love, like, I'm sure with the phlebotomy course, there's moments when students are like, I don't like blood. So like, I'm going to redirect myself here. Like I said, I wanted to work with animals, but like, I don't actually want to draw their blood. So
I see Michael had a question. How many students usually take both programs? So our max is 24 kids a block. So 72. And last year and this year, we were a little down because of COVID. But I think I had 56 students last year, and I have 64, I believe, this year. So out of my max 72, I'm pretty full.
My numbers are, last year I was 64. I have a feeling that my numbers are down because of COVID and requirements for the COVID vaccine and things like that. My max is the same as Carrie's. I have 54 this year. Was that your question, or was your question how many get to take mine and Carrie's junior and senior year?
Yeah.
That was the question?
Oh, okay.
Not this year. How many do you have for mine last year?
I have probably 30, I would get 20. I've got a decent amount from her. A lot of the schools, the bigger schools in our area, can only send so many kids. So they send seniors, and if they have more spots, then they send juniors as well. And then there's a handful of students that know they don't want to go down that nursing path. So they take my class 1 year and then they choose not to take hers because they know they don't want to go into nursing. So I would say probably a third of my students. Yeah, she has 2 of mine from last year, and probably a third of my total students are hers, which helps me with learning names. We do job shadows during the junior year. So if you're in our class, you get to do job shadowing.
If you're in Carrie's class, you no matter what age, junior or senior, you go do your internships. If you're in my class, whether you're a junior or senior, Tuesdays and Thursdays, we're in the lab until October. And then starting in October, we're going out to those 3 clinical sites.
The main question I have for that is, how do you get around HIPAA? How do you handle the HIPAA rules and regulations?
So we both are required to do a HIPAA presentation. So we do talk about HIPAA, we talk about ethics, we talk about all of that, and then we make them sign a form. And then, so they have to sign a WAC confidentiality form, and then they have to sign a job, internship, work-based learning HIPAA form. We talk about HIPAA pretty much all year. And if we ever hear students talking about anything, they're reminded they can't do that. High school kids, it can be tough at times, but we stress HIPAA a lot. And our facilities, a lot of them also make the kids sign a HIPAA form before they start. I know CGH Hospital, Morrison Hospital, and KSB and Dixon all make our kids sit through a little thing on their first day of internships and make them sign paperwork as well.
Yeah, I was going to say the facilities are great at reiterating what we've already taught them before we go into the facility. I have one of the facilities we go to shares a story, and they're brutally honest. They share a story of what can happen if you do violate HIPAA. So we really ingrain it in their heads before we even begin the importance of it. Mm-hmm. Do we offer? So I always share with my students any local facilities hiring. Local facilities will reach out to us and let us know if they're hiring or, hey, we really need help. Let the students know. So I always let them know what's out there and available. And then I offer any help that they need. I feel they're well prepared to go out and get a job, but use me as a reference. Call me if you need help with anything with your application process. So I have tons of students who use me as a reference when they're applying for jobs after the class.
Same. I had a lot of students use me as a reference. And, you know, with all of we spend like a month and a half doing the resume, the interview prep, all of that, so that our students are as prepared as they can be. But yeah, they use us as references. We share jobs with them when they open up. I'm still in contact with a lot of my students from last year. So yeah, we help them in however way we can.
I think you might have time for one more question if there is one, or again, they shared their contact information and I can put that in the chat again if you all need access to the presentation. I do have a quick question for you all. I assume you all are like certified to give the HIPAA presentation because of your experience as like nurses, and yeah, I would assume you would need that, right, in order to give the HIPAA presentation, or as long as you're like a qualified instructor. Do you know what I mean?
Well, we're both the fact that we're both RNs and qualified through the state to teach our classes.
Yeah.
That's what we
Yeah,
have.
I think that's
Yeah, I would assume if you can teach the course,
right.
offers that you can do the HIPAA presentation, right?
I had to go through a training for my course to be a CNA instructor and be certified through the state. And so I went through a train the trainer program and all the things that I needed to go through. Being an RN was one requirement, and then doing a train the trainer program. And there was no specific certain training on HIPAA. I mean, as nurses, we go through extensive training on HIPAA.
Yep. No, that's really helpful. We get a lot of questions about how you get around HIPAA, and you don't get around HIPAA. You just do HIPAA, right?
Yeah,
like you go through the presentation, you go through the forms, like there is no, if you want to be in the hospitals working with patients.
Correct.
So do we have time for one more? All right. So is there a reason that phlebotomy is not dual credit? So in order for us to offer a class as dual credit, the local college also has to offer it, which they saw that we were starting a phlebotomy course. So they did bring phlebotomy back to the college, but they offer it as just a quick, like 4-week online certification, and they don't offer credit for it. So we did talk to them again at the beginning of this year and asked, do we think we should make this a dual credit class? And we kind of decided that they get to be certified at the end of the year. And there were a lot of hoops that they would have to jump through to get it, to offer credits for it. And they kind of just decided that they don't want to hire an instructor to come and make it like a full semester class or anything. So we kind of just went along with that and said, you know, our students were happy that they get to be certified, and that's where we stand right now. And we said we'd kind of talk next year too and see if we do want to change that.
Wonderful. Well, thank you all so much, Carrie and Sheila. And again, I think with the phlebotomy and all those courses, the way that you direct students to and through pieces, right? Present them with information, help them understand what they need, get the experience, get the skills, get the content, and then moving them into, you know, phlebotomy, applying for that, like what opportunities are available and being references. That full spectrum is just so valuable to ensure that students stay on that path. So appreciate you all so much. Thank you for sharing. And again, if you all have questions, these were great questions. I love when we kind of have a smaller group like this, because I feel like we can actually chat and ask questions in a more informal way. But I'm going to turn it here to Danielle, who's going to talk us through team-based challenges. And I'm going to share my screen here just a bit. You can see who Danielle is here. And then I'll put up that definition of a team-based challenge, Danielle, and then let me know if you want to share or anything that works for you.
Okay, I will have a couple things I want to share. Welcome, everybody, and thank you for your time today. It is interesting. As Heather just put my title on there, I've recently switched positions over to the Director of Student Services. So this morning we were running our first shield, testing with COVID. And what I do want to share with everybody that I'm excited about is we had to hire additional nurses and CNAs, and more than half of our people went through our CNA program. We hired one nurse last week, and she completed the very first CNA program back in 2012. That was through our district. Half of our CNAs went through our program. Some of them are recent graduates who just graduated in 2020 with their CNA certificate, and then are now working as CNAs while they're going to college at the community college. So it's exciting to see that the opportunities that we're doing in school are spreading and making our students more employable right now. So when it came to team-based challenges, we started out and we sat in a room with a group of people and we're like, okay, how are we going to do this? And the very first natural place the group will go is, oh, we've got, we have these competitions that we can do. We have those regional competitions. Let's put them, like we have HOSA. We'll all get them in HOSA, and that'll be the team-based challenge to connect them. And the more we were having these conversations, we realized that an equity issue presented itself. Because if a student couldn't become involved in an activity, if a student couldn't participate after before school because they were working or they were doing something else, it suddenly we started eliminating what kids could do and earn. So then our group came to the conclusion that our team-based challenges must be embedded within the courses. So we actually started something in our curriculum process to where how much we approve our course objectives for a course. We also then add on and approve the team-based challenge for that course. And this was very important to us because it became a requirement of the course that no matter what, then we would know that our students completed the 2 team-based challenges because they completed them within these courses. So that was something that was kind of an aha moment for all of us and how we wanted to approach this. The next part of the team-based challenge is we sat together in group, and health sciences was the very first one we did. And everybody started throwing out ideas. And our community colleges, Harper, they have great resources and simulations there. But then as we started going, we're like, well, what happens if their lab was shut down? What happens if we can't get there? What happens if there's no money for transportation? So we said, those will be the yes ands. So we don't want to stop those opportunities, but that wasn't going to be the required one of the course. We really focused on what is a team-based challenges that is going to reach the most amount of students. So then we went to the resources that we had in front of us. And knowing that this definition, you had to have a problem-based learning project in the area of interest, working with employers in the area, and of course, having that mentoring. So one resource, and I'm going to share, I'm going to share with you guys a screen. Oh, wait, I wasn't on it yet. So one site that we went to that has been very helpful, in case you guys want to write it down, the National Center for Case Study Teaching and Science. It is an annual subscription, but this site became very helpful for us, and we embedded a bunch of case studies into medical terminology. And they have case studies related to all different health science careers. So it allowed us to come up with different case studies, different situations, because what we found is our healthcare professionals are more than willing to pair with us. But it became a challenge to kind of figure out what do we want that to look like. And then this is also attached to the University of Buffalo. So this is also vetted. And then I was going to show you.
Right now, I know she's got another one at 1
I
o'clock.
believe I have to stop sharing to share another screen. This one. So an example of what one might look like. Sorry, I'm scrolling. I was looking at it earlier.
11.
So one of the things like this just
Thanks.
happens to
Bye-bye.
be caffeine, but it'll say who it's by. Many of these are actually created by professors at different colleges. But it'll give an introduction, a situation, it guides them through the questions. And it was there then ready-made for the teacher, vetted out, and we had something. So what our team did then for medical terminology is we went through all of those different case studies to see which ones fit into the curriculum. And then we also tagged it with who are our guest speakers that come in naturally? They were already having somebody come in, you know, different doctors come in from different areas as guest speakers. Now we tied the case study to that guest speaker coming in. In addition, we started utilizing a bank of resources of doctors and people in the position that we could email. Because what we came to the conclusion from, and I don't know if Heather's gonna be upset with me, is not everybody could necessarily come in. And what happens if a doctor cancels or a nurse cancels or somebody cancels? Many people were willing to keep the correspondence up though, because we broke them up into teams of students. So that became helpful. The other thing that we tied into this too was we found many case studies on the heart. And when we could, we do the live from the heart with the Museum of Science and Industry, where they watch a live heart surgery and can ask the doctors and nurses questions. It is an awesome experience for our kids, but it connects with the doctors that then they could filter back to ask some questions that had to do with their case study. So again, we kept looking for those natural connections that we already did and said, what's missing? So if we were already doing case studies, what was missing? We didn't have a mentor. Okay, let's put the mentor in. And that allowed our teachers to not feel like this was one more thing that they had to do. They took a look at their curriculum, they took a look at what they were doing and said, what are we already doing? And let's do it. And so our endorsement in health sciences ties together med terms, anatomy, physiology, and CNA. So we did the case studies through medical terminology with the options of the yes and. So we definitely do the case studies with the mentors, and they have a presentation at the end of what they found, how they came to that finding. We tie it to the course curriculum. But then if you wanted to do other additional stuff, you still can. So if the class ends up doing, 4 team-based challenges, that's great. More experience for them. But again, you have to do that one. Now, when it came to CNA, this one was a bit interesting because they're like, well, aren't they already doing kind of a team-based challenge when they go out in the hospital or in the nursing home and in the hospital? And I'm like, but that's kind of like that's their internship in my world. That's what they were doing. So we wanted to help students think in different ways. And so CNA also wanted to stick with a case study idea, but went a different direction. And they found a geriatric simulation kit. And it was interesting to discuss all the different options in there, but they really wanted, as we've got young 17, 18-year-old students that are helping family members in a nursing home. And we wanted them to kind of understand or get a feeling for what might the patient's world feel like. So it became very important to our CNAs that we found this geriatric simulation, again, tied it to the course. So it's part of our course objectives and curriculum. And I also had that. We made it very simple. What we have written up is different than what we have on our website, but I'll share this right now. All we did was the team-based challenge. What was the industry challenge? The equipment needed, the mentors, and a presentation. We wanted to make it simple. And as you can see, we put it right into our course objectives. There is a more written up description, the one that we worked, IWIN handed out that we led the team through it, but at least enough. We didn't want it so binding too, because for us, our course objectives are approved by our school board. So if we made slight changes to this, we would have had to change a lot more. But literally what they do is the students then go through this simulation. And the nice thing is who are their mentors as they're going through things and taking notes? Well, we have the nurses that come in to help us do all the testing. And with the students being at the nursing homes, they can ask and go through it live as they're going through the simulation as the healthcare professionals with them, as it's an ongoing basis. That is our mandatory one. But honestly, the best one that we do is when we go over to Harper Community College and their simulation. I mean, that is the goal. But like obviously last year we couldn't do it. So that's why it's nice to always have this backup. Always have it tied to the course and its outcomes. So those were, again, the 2 different places we went. The reason why we went with the one for CNA was because we wanted the students to understand better their patients and who they're working with. And then 2, we want to make sure it's tied in the class. And we wanted to start with a place of what are you already doing that you love to do? We just need to infuse these extra pieces. And even this summer, when we added on a lot of the other endorsement areas, it was very easy to do. I don't want to stop there and see if there's any questions.
And Danielle, I was just going to comment that email correspondence is totally good.
Yes.
It's that you're having that direct connection, right? Like we all know that schedules tend to like go awry, right? But how are students being connected directly to someone who just has different expectations than their teacher, right? Like students, quote unquote, like figure out school. I say this all the time, right? They figure out how their teacher works. They figure out what they got to do to like get a good grade. Like, you know what I mean? But then all of a sudden they have this industry person and they're like, you're like talking to me, you're expecting different things. Like,
And the other good thing that it did is it really helps us have that conversation about soft skills and how do you communicate with adults in the business world, and how, you know, you have to think through what you're saying and you can't be slang when you talk, you know, and so it's opened up a whole nother level that I think is a benefit to our students and our teachers, even though they're in science classes and health science, it's important for them to teach those skills as well, because they know it's important for them afterwards. So we have used case studies for some of our other endorsement areas as well. Not as many though, because like in the business, there's a lot more that's just naturally there to be able to use. But in the, I'm trying to think, in manufacturing, they already had built in challenges that they have to do anyways to earn certification. So some of the areas already had things aligned. But the case studies allows them to really think through all of the different stuff. We also utilize the animatage. I don't know if any of you guys have an animatage. It's for anatomy physiology. It's a digital cadaver. There's actually built-in situationals into the digital cadaver. If students kind of want to see or different situations, and that's been helpful as well. I know these will grow because it's our first round. We started these 3 years ago. The whole point, honestly, was to make it as seamless as possible the first couple of years and not be overwhelming, in order to then build upon that for the future.
and we do have time here if you all have questions, but I think why I was so excited to bring Danielle and the work that their team has done is that it's been so thoughtful, right? So the team-based challenge being embedded in that course, I know tracking is a big concern as folks think about offering endorsements, or they think about, you know, CCRIs, the College and Career Readiness Indicator, and all those. And so having it in the course, it's on their transcript, right? So that course code signifies the team-based challenge. Also just bringing teachers together. I think, you know, having been a former high school teacher, there were a lot of things I already taught that could have been adapted to be a team-based challenge. And I think instead of presenting it as this like new thing that has to be done and curriculum has to be totally reworked, right? Like, where do we have some strengths and activities already? And where do we already have those partners to incorporate within? I think starting there as you work with your team and your teachers just creates a more collaborative, like motivated conversation than like, okay, we got to do this team-based challenge. Let's figure it out. Really building on the assets that you already have is so key.
And really our industry partners around the area were key in helping us figure it out. Like I will tell you, as we went through all of the case studies, some of them, they're like, either kind of let us know, you don't know how complicated this is, I'd pick a new one. Because as we found that site, there's varying levels of, you know, just how difficult it is with the complexity of the text. So it was helpful in some of those to have the industry partners take a look at them and say, okay, these are some good ones that I think you guys could do. And it was important too for our staff to have that option of more than one case study in a class, so that we could get a bank of them that worked out.
Yeah, which speaks to as well, I think the teachers and the different things they're comfortable teaching and facilitating and helping coordinate. It's great.
And I will say this too, like even some of the stuff we're doing in health sciences and businesses, for those of you guys who know of HOSA or BPA, one of the things they're trying to do in our district with our different classes is how can they incorporate some of those different simulations within their class. So that is the next step that I know we didn't start there with health sciences, right? But you grow and you understand. And so when our business classes jumped on for BPA, our BPA sponsor said, wait a second, why are we trying to go find stuff? We've got a whole, state organization, national organization that has these. Why couldn't we tweak them and bring it into the classroom? And so that is another model that we've been incorporating now as well. And then as HOSA has grown so much, incorporating some of the different HOSA practicals and simulations. Virtual reality. So not in this class yet for virtual reality. I know for one of our dual credit classes, we incorporated virtual reality last year when it was a requirement of the dual credit course to go to a museum, and our kids couldn't go to the museum. So we used the VR goggles because we have them to do that. That we do have VR goggles in our schools. Thank you for that idea. I might go back and see what they can come up with. I think that's a great idea.
I've never done one of those, and I bet it's like so trippy. Wonderful. Well, thank you so much, Danielle. And again, if you all have questions, please feel free to put them in the chat. And I put your contact info there. I know Danielle's always willing to share and collaborate and talk with you all. So thank you again for all the work you do.
Thank you.
And with that, I will turn to our final presentation here from Nick and Angie. Let me get my screen up for you all. Great.
I'm unmuted. We ready to go?
Ready.
All right, great. Well, hi, everybody. My name is Nick Chatterton. I'm the EFE director down in Danville, Illinois. Well, up if you're south, I guess. And I just, a lot of what we have to talk about is very similar to Whiteside. Angie, my partner here in this, we were kind of talking off screen, just that we're regulated so much by IDPH. I think a lot of our CNA programs are going to look kind of similar. I want to briefly just touch on our entity is a little bit different because we had some circumstances happen historically. I want to briefly run through that because it really leads to where we are right now as we offer this course. And then I'm going to turn it over to Angie. She's just going to kind of give some of the highlights of our CNA program, how we do things. We both took a lot away from the two presentations before us. So we've definitely got some best practices to take away and maybe hone ours a little bit better. So just to reiterate, we're an Education for Employment office. There are 58 of them in the state. So each one of your public high schools belongs to one. Hopefully you know your EFE director. If you don't, you should really reach out and make sure that you find out who that person is, because we're designed to support your programs both financially and with professional development. But they've each got a different local name. Right? If I said to one of my high schools, I work at EFE 400, nobody would know who that is. But they know what VEDS is, Vermilion Vocational and Education Delivery System. And I see Cassie on here from Valise, and Amy Marito, I can't remember what yours is, but everybody's got their little local name. We're all kind of are governed by our boards of controls, which are representative of all of the high school districts for the most part, or school districts in our region. Go ahead, Heather. Funding, real quickly, my office, and I think a lot of offices are like this, we have a state or a federal grant called Perkins, then a state grant called CTEI that makes up a lot of our funding, and then generally we all have some sort of local match where we get funding from our participating school districts. Go ahead. Go ahead. You don't need to know all that stuff. Basically, after we get done paying for stuff collectively, we send those funds back out to our schools to help support their programs. I wanted to touch on the history real quick of our entity. We used to be an area vocational center like Whiteside, so we were a standalone building. It was all funded, and all the instructors were hired by the cooperative. About 20 years ago, we had just some different things happen that caused our area vocational center to basically become insolvent. So my bosses, my superintendents approached Danville Area Community College and with the request to have blocks of time Monday through Friday for the high school juniors and seniors to be able to attend classes on the college campus. So now that's where our area vocational center is, and my office is on the campus of Danville Area Community College. A little more than 18 programs now, 73 courses, and CNA is part of that. Go ahead. And that's all what we offer currently. We've got a couple other ones in the hopper that we're hoping to add for next year, including possibly a second year of health occupations. We used to have CNA for first year students, generally juniors, and if they wanted to come back, they did some sort of work-based learning experience. And that was going on when I first took this job, and I cannot remember for the life of me why that went away. It could be a variety of reasons. Maybe it was just not being able to find a place for these students to go, lack of interest, lack of personnel to be able to handle it. But Angie and I were just talking that we really need to bring that back because we have a lot of students that I think would really be interested in that, and a lot of need in our community for those students to be able to provide those services. So go ahead. So that's pretty much all I have to say about our entity. We have a certified nursing assistant program here on the campus. We offer it to our Danville students. Come in at 8:30 every morning, stay till 10. Our what we call county schools, or our more rural districts, come in from 12:30 to 2 every day. They take, I think we've got 3 courses in the rotation. I'll let Angie kind of speak a little bit more to what that is specifically. We're not going to drone on and on because, again, Whiteside pretty well covered a lot of the things that we do, but maybe it just sparks some conversation. If you hear something that's different about our program that you don't have in yours, we can talk about that. So I'm going to step out of the way and let Angie come in.
Hello, I'm Angie. I am the program coordinator over the Certified Nursing Assistant program here at Danville Area Community College, as well as the lead instructor. I also teach outside of the CNA program. I also teach medical terminology as well. If you don't mind just going ahead and starting my presentation, please. Okay. First off, I want to say that I'm actually a product of the vocational school that Nick was talking about. Before Danville Area Community College started the College Express program, it was actually known as VOTEC, and it was the standalone center where students could go their junior or senior year and actually take CNA and other courses as well. My junior year in high school, I actually got my CNA license or certificate. And then my senior year, I actually got my first responder and EMT certificate. So that was a pretty, neat course. So teaching in this course, I actually share my experience with students so they can see that, there's multi-levels of nursing. And as long as you stick with it, you can progress and actually choose different course or careers throughout nursing. Just like Nick said, Whiteside did cover a lot of our program requirements because, again, we are regulated by IDPH, which is Illinois Department of Public Health. And they basically are our go-to, our bosses that tell us everything that our students need to learn and understand as they complete our program. So our program, usually the state of Illinois lets you pick, as long as you have a minimum of 75 theory hours, you can decide what your program itself wants to do. And here at DAC, we require our students to have 99 hours in theory. We just feel that that benefits our students. It gives us more time to cover some things where, less hours, we just kind of feel like we may not get all that information covered. Also here at DAC, our program, the College Express program, we have multiple schools. So like in the morning, like Nick was saying, we have our Danville District 118 class, our school on campus, and then in the afternoon we have county schools, and that can encompass 4 to 5 different schools. And so what we find that happens is a lot of these schools are not in session on the same day or something. They have early out days. So we just feel like the 99 hours actually benefited us better. Our clinical, though, is just like Whiteside. It's 40 hours of clinicals, but our program is set up a little different than theirs. They were discussing how at the end they do their interview process. We actually do a Nurse 107 in the beginning, and that's kind of like our pre-employment course for our students. It goes over, job roles, expectations, like interview processes and things like that, to where we actually get them ready for an interview during that course. And then we go into Nurse 120, which is actually the theory portion of class. And we cover all of our theory through December. Then in January, we start Nurse 121, and what that includes is all lab time. So we do have labs set up here in class that has beds. We actually use our students as patients. So we put a student in a patient role, we put a student in a nurse role, so they get that one-on-one actual individual, an individual nurse experience before we take them to clinicals. So that Nurse 121 course starts in January and it ends in May. And then our clinicals are at the end of the semester when all of the schools are out for the summer. So that's Nurse 111, and it usually starts in June. And our students, like I said, they go 1 full week. So they get that full, 40-hour week from morning to, it's usually 6:45 to 3:30 of clinical experience. We used to try and do it throughout the semester, but we found trying to fit in the time during class time, it just wasn't beneficial to the students because it was hit on miss on what skills we could actually utilize during that time. So we finally decided as a group that it'd be better to do it at the end, so that way they actually get a better experience. The skills are actually mandated by IDPH, and we have a booklet of 21 skills that our students have to be competent in before they are deemed satisfactory in the course. And then again, our state exam leads to certification. So if a student passes all the courses, then they're able to sit for that state exam. You can switch to the next one, please. Okay, so again, how it works, once students complete the classroom portion, they continue into a healthcare facility that enables them to use the skills that they learned in class. We have multiple facilities in the area that we work with. We work with our hospital, OSF. We work with 3 long-term care facilities in the area. So we do have a lot of choices that we can utilize for our students to get those extra skills. They are observed by an instructor. We are only allowed by the state to take 8 students per instructor. So we have multiple instructors that help teach class as well as clinical. But the students are able to go into a facility. They're able to sit in pre-conference. They're able to get their assignments. They work with patients. They are able to see the different nursing roles. They see CNAs work. They see RNs work. They see the DON. They see the multiple levels that are utilized in facilities. They are expected to follow the policies and procedures of the facilities. Again, just like the college before us was talking, they are expected to do confidentiality forms and all of that. And the DON at that facility and actually the administrator, they both come in and they do give examples of, HIPAA and confidentiality and some cases where things have not worked out necessarily to the best for violating those. So they do share experiences on those. And then again, they do work alongside employees. And what really happens sometimes is as clinicals start to wind down, we start to let them venture out a little bit more to where they can go in and they can shadow in physical therapy once all the hours are met, or they can shadow with a wound nurse, they can shadow with dietary. So they can kind of see other areas that, that they might want to be interested in, because we do tell a lot of our students that this is the entry level of nursing. This is where you're learning your basic nursing skills. And sometimes students come into this class and they want to be a nurse. And as we start to proceed and class progresses, they realize this is not what I want to do. We do have a lot of students that want to go into dental hygiene, or they want to go into radiology. They want to go into phlebotomy. So they use our course as a stepping stone, and that's okay. And we welcome everybody, but it's a nice course for everybody to start in. Can you switch, please? So again, I already touched on these. These are just some of the facilities that we do utilize. The wound care, a lot of students really find, because at times that can kind of be disgusting and it interests them because they get to see something other than actual patient care. We do have, like I said, some students that want to go into dental hygiene. And I do like that Whiteside was talking earlier about that as well. We don't have anything in the area like that we've actually reached out to where we've been able to utilize their facilities. But I think that that's a good idea, especially we have another college in the area that it's actually a requirement for their program to go through the CNA to get into their dental hygiene. So that's something that we could look into. And then again, the hospitals, we just basically use the med-surg units, for all the patients that are on there. Next one, please. Thank you. Okay, so what we really like, and this is one of the things that I really like about the program, and where I kind of build on my experiences from when I started when I was a junior till today, is I always tell students, you're starting at the bottom of the barrel. You're starting at the basic nursing skills, and the opportunities are endless. In nursing, you can do anything. You can teach. You can do patient care, you can specialize in so many areas. And like my daughter, just for example, she actually went through the program last year as a junior, and she doesn't want to do any type of patient care whatsoever, but she wants to go into pathology and research. And so this, again, is something that she needs and that will help her build on that in the future. So patient care experience is always a positive thing when they get to work with people, but a lot of students don't want to do patient care. And that's okay, that students understand that they don't have to do patient care. There are so many other things that they can do, but this is, again, just a stepping stone. The positive thing for everybody is it's a certification. It is something that they can use in the future. It is something that they can work for in the future. It is something that will look amazing on college applications or other program applications. Even if it isn't nursing, it'll look good on veterinarian schools that they went through this program. So there's so many opportunities just from getting a CNA certification. Just like the other program, all of our students are CPR trained. And then again, like the employment tuition reimbursement and program advancement, all of those kind of loop together. A lot of our students get hired by the facilities that we do our clinicals at. A lot of them are interviewed right there and hired almost right there. And a lot of them offer tuition reimbursement. They have to give them a year of employment, but usually they get a pretty good tuition reimbursement. And then again, here at DAC, our nursing program utilizes our CNA program as a point system. So if you have CNA, you get so many points, and it kind of moves you up on the list to get into the nursing program. Next one, please.
That's what
Sorry, it's a lot of repetitiveness from the front. I was telling Nick, I was like, I feel like we're repeating everything that they're saying, but again, it's kind of nice to hear because we're regulated by IDPH, so we're doing what we're supposed to be doing. So.
No, I appreciate it, Nick and Angie. And Angie, I just want to, all the pieces you shared about, like, it's okay if they don't want to do this. It's okay if they find out they don't want to do this. Like, it's such a great opportunity before they really committed to a post-secondary program to find that out, right? I think people who want to be nurses maybe sometimes find out they actually want to be teachers and help people, right? They don't want to deal with any sort of bodily, just no.
Right.
That's it for us.
Thank you.
Would love to, if there's any questions for the group. I think even the model full-time work experience at the end is really interesting to me as well. And I know, like, technically in the CDE, there's that 60 hours. So I guess, like, curious too, where there could be like a little additional, like, micro internship for 20 hours or something for students, for those folks wanting to meet the expectations of that definition. But
Well, I tell you one thing that I don't think has been touched on here yet, and this is all developing stuff, but since we're on a college campus, first, all of our students have to either test or vax. And so we're starting to try to get our heads wrapped around that situation. Furthermore, right now, one of our facilities requires our students to be vaccinated, and one currently requires our students to be tested. Wouldn't surprise me if we get to that point in time that all students are going to be required to be fully vaccinated. So, you know, as far as you know, the testing of all of my students on this campus, we're still trying to figure out, you know, who and when and all that sort of thing. But Angie and I often, before this was all going on, thought about some of our former CNA students being able to kind of help with that. But then additionally, how we're going to handle, well, I mean, there's not much to handle, but I've already had one parent call me and say, is it going to be a requirement to either test or vax? And I said, well, yeah, that's going to be the deal, whether it's here on the college campus or at the healthcare facility as well. And, you know, this person's personal choices said, well, my daughter's not going to do either. And that's a hurdle. That's something that's brand new for us to have to, you know, have those conversations about. I'd certainly love to hear if anybody has this all figured out that could share the secret sauce. I'd love it if you wanted to share that with us, how you're handling that sort of thing.
Nick, I don't have any secret sauce, but I know that Indian Valley Vocational Center Director Joe Barbic, they experienced the same thing. Their clinical sites, before the governor's executive order, their clinical sites required vaccination, and they had 2 students whose parents would not allow them to be vaccinated, so they had to withdraw from the course.
Yeah, we're hoping that we don't have a whole lot of that. We haven't rolled it out yet. I mean, we have told the students that this is coming, but I haven't, you know, sent an official letter on a letterhead yet, just because I don't want to give out information that I don't have clear-cut end answers to. So it's just a holding pattern for right now for our students, but they know this is coming. It'll be interesting. It's kind of a brave new world out there in higher ed and secondary, but especially for our CNA students.
Maybe this doesn't help. I know last year at the end of the year, our kids just had to show a negative COVID test every day that they went.
Yeah.
For
So
the
we-
nursing homes, not the hospital, but for the nursing homes.
So we, last year, when this all started coming around, like I said, we don't do our clinicals till June. That was our option. We had to test, not every day, but every other day. But now that facility is the one that's saying, no, they have to be vaccinated, they can't come in. But we do have some other facilities that are understanding, and they're like, you know, we're not mandating them to be vaccinated, but they do have to test. And so I like this scenario that we're coming into right now, because students are able to see some of the ethical decisions that we may have to make in healthcare. And so it's kind of, they're getting an experience and with information that they're learning about in class. And, you know, we're not trying to push anybody to do one thing or the other. We just want to be able to give them the opportunity. But, you know, like Nick said, right now it's kind of hard. But that, like I said, there are a couple facilities that are allowing us to test our students and that they don't have to be vaccinated. But again, it's just, we don't know where we're going to be come June.
Yeah. Yeah, we ought to have this in June and see how things look.
Yeah, up here in the northwest part of the state, our kids are required to be vaxxed to go to their clinicals. So what we're doing is, if they won't get vaxxed, our teacher will continue to teach them, but they won't get their clinical experience and they won't get their college dual credit. But so they basically wouldn't get their CNA, but they would get the coursework, so that if they go on to a junior college and do a nursing program, they could get it then. But we're not shooing them back to the schools, because we're not on a college campus either. So we're trying to keep them in the program to see if something changes throughout the year, but right now that's kind of where we're at up here in the Northwest.
I think that's where we're kind of at too, is because we don't want to dismiss them, because again, you have no idea what's going to happen. And we don't want to excuse someone if the ability is going to be there for them to be able to continue, but they are underneath the understanding that if that is what it comes to and you don't, then you're just receiving your high school credit. So they are going to receive credit. It's just not in the aspect that they were hoping to.
Right.
Yeah.
And I mean, just because we're on the college campus brings another layer of restriction. And I mean, the hope, our president said the hope is that we don't lose any, that we can make some sort of arrangement for any student. But of course, that has to be it's almost like our little secret. We want the students to either just conform to testing or vaccine, so that we don't have all of a sudden this whole new set of 18 courses that are taught remotely in addition to the ones that we're teaching in person. So it's a very delicate thing to have to deal with. But hopefully we come out on the other side okay.
Yeah, and I mean, I assume ultimately if these students do want to work inside of a hospital or access a job or it's kind of like kicking the can down the line, right? Like they eventually are going to have to address this if this is the career they want to pursue.
This is just so new for everybody that, and it's so obviously politically charged. I mean, when we ask them to have a TB test or anything like that, there's no real pushback on that. My assumption is that someday this will probably look very similar.
And I think the other complicating factor is when you're under 18, your parents have to consent for your vaccine. So 2 of the young ladies at IWIC wanted to get the vaccine to stay in the program, but they can't without their parents' permission.
That's true.
Yeah.
Well, appreciate you all for continuing to build robust programs and grapple with what's always something new every year, right? Whether it's a global pandemic or not, there's always something that changes, a little shift that turns into a big thing that you got to address, right? But just appreciating all our presenters for sharing today and the really high quality models and experiences and supports you provide for students to direct them on their career path. You know, I think really hearing today too, the way that all these different work-based learning experiences are embedded in coursework addresses issues of equity and access and making sure that work-based learning is no longer this add-on thing that you do for this pathway, but it's something that is truly a part of a student's experience while they're understanding what is it that I want to be when I grow up, like as I'm grappling with just being a high school student, right? And just really getting them into that. So just a big thanks and kudos to you all for all that you do during an especially trying time, you know, when school is, it's always, it's always a lot. So thank you all. I was just gonna kind of share a couple of announcements here, and I like to always give time to, if you all have different like events or anything coming up or additional resources that you want to share. But 2 things I wanted to call out. The Illinois State Board of Education has released their most updated work-based learning manual. And so they have guidance for experiences all along the continuum. I would say that this very much is a living document. As I've chatted with some of the folks I work closely with at ISB, they would love to get feedback on this, love to get additional resources that should go into there. I think ultimately getting to that end user, so the teachers, the coordinators, the folks who are really implementing these experiences, as they could look at this manual and provide any feedback. I think those edits, those suggestions, those insights would very much be incorporated into this manual. And myself personally, kind of working close with ISB and supporting pilots across the state, I'll be continuing to look at this manual and work with them as well. So please feel free to share this, offer feedback, very much that living document. And then I put Karen's information there too, who has kind of spearheaded this and put that out here, who would be a great contact for you all if you did want to grapple or had questions about anything within the manual. Also coming up tomorrow, actually, and I mentioned this earlier, I'm very much trying to align what we're talking about here in IWIN in terms of the work-based learning in the industry area with what's being discussed in a program of study or more kind of like deep dive on those strategic dual credit and career focused courses within a student's experience to and through high school to post-secondary. And so tomorrow at 2 p.m., they're going to be hosting an informational webinar about the health sciences model programs of study guide. So it's designed, you know, for community college faculty and staff, particularly those academic deans and department heads, early college liaisons, employer relations staff, but also very much open to the high school faculty who are working in those pathways. So please feel free to forward this registration link. Again, I'm going to put the presentation in the chat one more time. I think everyone has it, but just in case, there's the link to register in there. It's just the first in a series. So they're going to continue to talk through Juan Jose and Megan, actually, who's on the line here, our new Pathways Manager, will be speaking through the different model programs of study guides. And we'll do the best we can here in IWIN to kind of align and recruit presenters to talk about work-based learning related to that model program of study area that they will discuss. You can kind of get the best of both worlds. And those will all be recorded as well, but would encourage you to register and make sure that you're on their communication for that if it's something you're interested in. Put up some additional kind of events and resources here. Illinois Community College Board is hosting their Forum for Excellence this week. I'll be presenting on the work-based learning continuum on Thursday from 11 to 12. I had sent this in the newsletter, but Iowa has a really robust health science work-based learning toolkit. It has a lot of great resources and materials and insights in there. You know, their definitions are different than ours in terms of like career exploration, team-based challenge, career development experience. We have those outlined here in Illinois, but there's a lot of great stuff in there that I thought would be a good resource for you all. I also linked in a presentation we did last fall where we had some folks come on and talk about their career development experiences in health sciences. I believe, Michael, you were actually one of those presenters, along with Jennifer Irvin from BJC Healthcare in the East St. Louis area. Also, just want to keep flagging these different design workshops. So over the summer, and these were kind of our first pilot of these, and we'll be offering some more robust ones and offering professional development hours as we go through the year here. But really just took folks through, you know, it's an informational video about each experience, and it deep dives that experience, the definition, models, and resources. And we also have a lot of templates available on the IWIN site, if that's helpful for you all as you want to design and work with your teams to think through these experiences. The templates are not required by any means. They're really just there for designing and collaborating. But we'd love to know too from you all if there's other events or resources or anything that you think would be helpful to this group. Please feel free to share out loud or throw that in the chat too. You know, there was a virtual reality speaker I saw someone put in. Yes, thank you, Michael. It's virtual and free. I think that's always, so many conferences I think are going to move to this, right? Or at least have a hybrid option, but being fully virtual, and then when it's virtual, the cost incurred by that is so much lower than offering a big in-person conference, and so many people can access it, watch recordings. There's a beauty to in-person too, but I think this virtual platform is here to stay for those conferences, a virtual model, I should say. Well, I'll just wrap us up with some next steps then here, and I can keep the line open too if y'all want to chat or have any additional questions until 11:30. But I will send out, you know, the recording materials from today shortly. Encourage you all to continue to submit resources either directly to me at hpenzak@niu.edu or through the IWIN site. Would also love to know of any recommendations you have or interests you might have in presenting on education and or information technology. Again, we'll be doing the full continuum. So career exploration, team-based challenge, career development experience. If you have recommendations for that within or outside of your community, would love to know about those. And I'll do the legwork, recruiting and coordinating and getting all this stuff together for them to come and present here for you all. But thank you all again for joining today. I know the school year has started, but just continuing to wish you a wonderful start as we grapple with so much, but also so much wonderful. And just really appreciate you all.